Really?
But let's talk about
Okay.
teeth first.
So we're going to tell them about your practice. You're right off of
We're on Military Trail between Glades Road and St. Andrews, or Glades and Yamato in Boca Raton. We've been in business as a practice for more than 50 years.
So this is the Ask the Expert show. Here we are every Thursday from 5 to 6. Today is our periodontal day, as you just heard, and we do have one of the principals, Dr. Fred Norton, on our show live here in studio, and we're talking about missing teeth. Hi, Doc. See, he gets in traffic. And
A lot of traffic.
You didn't yell at anybody, did you?
No, I didn't yell at anybody. Kept my cool the whole way.
Did you smile?
I try to smile.
When they smiled, did they have all their teeth?
Most of them.
Okay.
Some are teeth. Some are here, some are there. They've got summer teeth.
So we're going to start off with, a lot of people don't even know what periodontal is.
So periodontics is really the foundation of our entire dentition, our entire mouth. Essentially, it's the gum and bone that supports the teeth. The profession, or our specialty, has really evolved over the last generation, essentially, to the point that we now have tremendous amount of science to support what we do in helping patients to preserve their teeth by making sure that their gums and bone are healthy, and if they're diseased, to make sure that we can get them healthier. And then in the instances where people are already missing teeth, or they're going to lose teeth because of either periodontal disease or old root canals that are failing, or broken teeth, or tooth decay, our profession has really evolved now, where periodontists are among the group that are responsible for replacing those missing teeth with dental implants, meaning new tooth roots.
We had someone ask last week, they called up, they thought your show was going to run. They wanted to know if periodontitis is hereditary.
Well, it is. And
it is, okay.
Yeah, we've identified the genes that are responsible for passing it down from mom and dad, grandma and grandpa. And that's one of the greatest risk factors when it comes to, is somebody going to be at risk for losing their teeth? So it doesn't mean you're guaranteed to lose your teeth, so I should just raise my hands and give up.
Right.
By all means, exactly the opposite. But we can actually test people genetically and identify if they're going to have a more exuberant response, a greater response to that same bacterial plaque that causes the disease, that causes inflammation. So we can test those people.
What do you do
if
you find out early like that?
Well, first of all, it's a really simple test. It's literally a saliva test. So it's not, you don't have to go for blood work or anything that's all that invasive. It's literally a saliva or a spit test, for lack of a better description. So we can identify.
How early?
We can do that for people when they're in their 20s.
Wow.
And so we can identify and say, wow, Steve, you're at risk, or Steve, you're not at risk. And then we can load on top of that some of the other things. We have ways of calculating risk factors for people today. Things like smoking, which taboo, you shouldn't smoke, but there are still smokers out there.
Right.
Those people are at greater risk. But then when we combine that with certain genetics, we know that those people are at even greater risk. And so we can be a little bit more aggressive in how we treat them. And that might just be more maintenance with the hygienist every 2 to 3 months versus once or twice a year.
So the cleaning would probably go under the gums more.
It may. But the key here is to identify those people as early as we can, because just because your genes say something's going to happen doesn't mean it has to happen. It just means if you're aware of it and you're informed of it, then you've got an opportunity to really shape the direction that goes in.
We have shows all over the United States. It's not called Teeth in a Day. I mean,
right,
it's,
Teeth Today.
In Texas, they call it, when I was going Teeth in a Day, they go, what is that?
Right, we call it Teeth Today.
Teeth Today.
And it's something that our group developed. This concept is something we developed almost 20 years ago. So people say, wow, that's so new, that's so cutting edge. Thank you, but the reality is that we've been doing it for 2 decades, and we've been doing it predictably and successfully for 2 decades, helping people who are losing their teeth, soon to be missing teeth, maybe they're already missing teeth, and have been too embarrassed or frightened to come back to dentistry. A lot of these people are what we describe as dental orphans, meaning they've left dentistry because they're convinced that there's nothing left to do, and their dentist said to them, you're going to lose all your teeth, you're going to wind up in dentures. Well, that's just a silly comment. Now, you can if that's what you choose, but we can do so much better than that. We could do so much better than that 20 years ago.
The difference in teeth today
Yes.
versus implants.
So teeth today involves using dental implants, meaning new tooth roots. With teeth today, the concept is essentially that we're going to put temporaries on top of those implants right away. And so it may be for a single tooth. You fell down and broke a tooth. We get patients that trip over a parking curb, that are out jogging at twilight, or they tripped over their dog, or they've got a failed root canal or a cracked tooth. So they may just lose one tooth, and the rest of their mouth is in perfect shape. We see people come in that are in their 20s, 30s, 40s, 50s. They're runners. They're at the gym all the time. They take great care of themselves. They're losing one tooth.
Right.
And that's part of teeth today.
And here we have an older audience here.
Sure.
A lot more mature. So some of them are using dentures.
Right.
They have no teeth.
Right.
So if they come into your office, are they going to walk out with teeth?
They're going to walk out with teeth that don't come in and out. So the concept of teeth today applies to both the single tooth as well as multiple teeth, including full arches, full upper, full lower, or a full mouth. And so essentially, for a patient who's in dentures, or a patient that has partial dentures, plates, or somebody who's soon to be missing teeth. Remember I said about that dental orphan?
Right.
That patient who said, you know what, I'm done. I'm not listening to my dentist anymore. They said there's nothing else I can do.
Because the dentist probably doesn't do it.
They don't do it. They don't know. They lack the sophistication. Or my favorite is they judge the patient just by how they look, which is an awful thing to do. Absolutely don't judge people.
So they walk in your office. They have an appointment. You've got to make an appointment.
Sure.
We'll be giving out your number. So it doesn't even take more than a day to do dentures?
These aren't dentures.
Right.
So
but it does take some longer than a... But you're saying you could do teeth
that's
day.
right. So we call it teeth today because
That's
they
amazing.
literally have teeth today. And what that means is in a single visit, we'll take out teeth that are failing, that need to come out. We'll place the new tooth roots, meaning dental implants. We'll attach the connectors. We call those abutments. And we'll make temporaries all in the same day. Now, obviously,
Wow.
we need to have some preparation in advance. You can't
Sure.
just come in without an appointment and expect
And what
it's
if
all going to
there's...
get done.
What if... Because I know you do this, you can actually build up the bone, too.
Absolutely. So
But that is that in a day also?
it's all part of the same procedure. So
Wow.
there's been an evolution in this concept over the last two or three decades, where one we do continue to build back the bone when we have to, but two, we sometimes now actually just angle the implants so that we can maximize the amount of bone that we have to work with, and then in doing so, we can minimize how much bone grafting we have to do. And so we have means to do that without putting patients through more exhaustive type of procedures, bone grafts, sinus lifts. We still do them from time to time, and they're very predictable. And frankly, I always tell my patients, you won't know we did it if I didn't tell you about it.
What? So it's painless.
Look, I don't want to say it's painless, but usually it's over-the-counters like Advil, Motrin, Aleve,
Right.
or if somebody can't take those.
Everybody has different pain tolerance, too.
Of course they do, and we'll write prescriptions for somebody for something for a painkiller, but more times than not, and when I say that I mean 95% of the time, maybe more, our patients will come back and say I took one or I didn't take any, and today people are so frightened of narcotics that they try to stay away from them, and we encourage them to do so as well, because the reality is they want to get back to their life. They came to our office specifically so that they could resume their lives. They don't want to continue to be loopy or
Right.
or missing out on things.
And they go back to work the next day?
They go back to work the next day. They'll
Wow.
be sore. They're going to be maybe a little swollen and bruised, but they can go back to work their next day. We ask people, stay out of the gym. If you want to go to the gym, go to the gym, but you're going to have more swelling and bruising. But go back to your life, resume your life. It's funny. The hardest thing for people is to realize that they can chew, and we try to encourage people. And
You said food tastes different even.
Food tastes absolutely, because if you've got a denture or partial denture or plate that covers part of your palate, or even worse, all of your palate,
So
you've got taste buds on your palate, and so your speech changes, but also your sense of taste changes.
wow, that's amazing.
Sorry.
So my sister in Dallas
Sure.
went and had implants, but it took 4 months.
Right. And so it's religion versus science. So religion tells us that we need to put the implants in, we need to bury them under the gum, we need to wait a certain amount of time and then come back, in this case 4 months, and then they can make the teeth. And that's great. That'll work. But the reality is that science tells us we can attach the teeth the same day. Science tells us that the implants that we use in our practice will integrate much faster than that, and that we don't need to wait 4 months. I can't remember the last time we really waited 4 months for anything to heal, meaning to integrate
really
into the bone. And it really depends on the implants that you use.
This is amazing. And now I know people out there, again, how painful it is. We've answered that.
You're gonna be sore, but
Yeah.
you shouldn't. You're not gonna be laid up in bed.
Are you
You're
able
not-
to eat the next day?
That's the thing. As I said earlier, the hardest thing to convince many people of is that they can eat. Patients come back a week later and say, "Well, I'm not really ready yet," and it's something they need to understand. They can do it. And I always tell them, look, you can go out and if you're gonna have a steak, get the fillet, not the ribeye. I'm a big ribeye person, but have the fillet.
Okay.
Have the softer cut. If you're going to have vegetables, get the steamed vegetables. You want to have some fruits and melons, why not have some melon, it's a little softer? Or if you want to have an apple, instead of biting into the apple, why don't you just cut it and have the apple? But so many people tell us, and then my favorite question to ask them is, when was the last time you bit into a crisp apple? And
Right.
they'll always tell you, oh, I love apples, but I don't bite into them. I cut them, or I
Right.
haven't had one in X number of years.
Dice them.
They dice them up,
Yeah.
or they don't eat them, or I cut my carrots really small, or I shred them. So there are so many workarounds. People find ways to make it work for themselves, but they don't have to.
I saw last night a commercial where a lady is eating in a restaurant.
Yeah,
You might have seen this, and she says, "Do you know how embarrassing it is when you have dentures and the glue's not there, and you got to go to the bathroom to put?"
sure.
You don't have to do that,
No, you don't, and not to mention, first of all, the food gets up under the denture.
right? I would think so.
And so that it's like having a pebble in your shoe. But so
That's
many
a
of our
good
patients are suffer from a dry mouth, and it's impossible to get a denture to fit. Not to mention those denture creams, a lot of them have zinc in them, and that can be really unhealthy for people to ingest. So it's not a free ride.
We're going to go to break, and we come back. We're going to tell people about your practice, how they can reach you.
That sounds great.
This is the Center of Periodontics and Implant Dentistry. We're here with Dr. Norkin, and we'll be back.
Get your smile ready for summer. Are you missing teeth? Do you have loose teeth? Can you bite into an apple? Is your smile ready to hit the beach this summer with confidence? We all work out and try to look great since we live in paradise. You need a smile to match. The South Florida Center for Periodontics and Implant Dentistry can help you replace those failing or missing teeth with a beautiful smile and the confidence you deserve. The doctors at the South Florida Center for Periodontics and Implant Dentistry have helped thousands of patients rejuvenate their smiles for nearly 30 years by replacing failing and missing teeth with dental implants. Often new teeth are replaced the very same day using the technique they pioneered more than 15 years ago. Teeth today. At the South Florida Center for Periodontics and Implant Dentistry, all of their doctors are board-certified dental specialists. They have placed thousands of dental implants. And we all know that experience matters. Call the South Florida Center for Periodontics and Implant Dentistry today to schedule your free consultation. Call them at 561-912-9993. You'll be glad you did.
Hey, we are back. We're here with Dr. Fred Norkin. He's one of the principals at the Center for Periodontic Implant Dentistry. Tell everybody where your office is.
We're on Military Trail in Boca Raton. The address is 3020 North Military Trail. We've been here in Boca since the 1960s, believe it or not, before I was born.
Well, I got to tell folks something because when we were first looking for a dentist, there's not a lot of dentists that do what you do.
Right. Well, there are a lot of
there's
dentists
some
that
put
try.
a shingle up
Right.
saying they do what you
Right.
do.
Right.
But, I mean, do you really want someone kind of practicing on you?
Right.
This is all you do.
It's all we do. So, you could go to your family practitioner to deliver a baby, or if you're having a heart attack or you needed plastic surgery, they're trained for it.
Right.
But family practitioners are outstanding at doing primary care. They're not really there to deliver babies.
Right.
And the same thing in dentistry. There is a reason we do specialty programs, and it's because the training and experience counts. So there are general dentists, there are prosthodontists, there are endodontists that are out there taking weekend courses, or maybe they did some training in their programs today. But the reality is that periodontists and oral surgeons, we are trained to do surgery. That's all we train
So
for.
board certified?
We're all, everybody, to be part of our practice, we're all board certified periodontists. And that basically is the last hazing ritual of a specialty. In other words, we all did our residency programs first, and then after that we had to go out and take not only a written exam, but then an oral exam. And then on top of that, every 7 years we have to recertify to maintain our
So you
board
can call
certification.
yourself an expert.
We
'Cause you're
think
board certified.
We believe we can.
Yeah,
That's right.
absolutely.
That's right.
So how long has your practice been open for?
Opened in 1965.
Wow. No one can say that.
Difficult to say. Difficult to say.
Did you, and how many dentists are in the group?
We're a group of 4 periodontists. So again, we're all board certified periodontists. So we all do very much the same thing. We're all very interested in, obviously, in trying to help people save their teeth, whether it's through surgical or non-surgical means. One of the things that we really don't touch on here very much is that our niche when it comes to periodontal treatment is minimally invasive periodontal therapy. And we've been doing that actually for about 14, 15 years now, using a dental endoscope, very much like an orthopedic surgeon goes into a knee or a hip to do arthroscopic procedures. We do something very similar where we make the tiniest incisions and are able to do full-blown periodontal surgeries with a dental endoscope, a little fiber optic camera.
Wow.
And so that's something that's unique. We're actually the only group, as far as I know, that have one in
isn't
this
your
county.
X-ray machine really unique also?
Right. Well, we've had digital radiography, digital X-rays for almost 20 years, but we're now on our 4th CT scanner. So we were the first ones on the block to get a CT scanner, and we just continue to upgrade them because the technology is so important and it evolves so quickly that to have an old unit just doesn't give us the
Right.
vivid images that we can get with those newer units.
Well, I'm going to bring up something that we haven't talked about. A friend of mine who actually had to go to the school
Right.
to get it done. Okay, so it's a little bit less expensive, but
Sure.
you're probably going to have a student working on you.
Well, you're going to have a student
Yeah,
or a
of course.
resident, and you're going to pay with your time.
So here's what happened with her. It changed her whole psyche. Now, she was only missing one tooth,
Sure.
but she smiled weird.
Sure. You want to hide your smile.
So I noticed when she got the tooth, her whole smile was different. Do you see? I mean, did
Yeah.
patients tell you that?
It's funny. They not only tell us that, they show us that.
Right.
They don't mean to, and they don't realize. But what happens is we see them start to smile with a much larger smile. So we oftentimes document our cases with photographs, and we ask our patients to show us an exaggerated smile. I always tell younger patients, show me a smile as if you're bumping into your parents at the mall. or I tell older patients, snarl, so we can see what they look like when their lip is all the way up. And the reason is we need to be able to plan all that because nobody comes to us for implants. Everybody wants teeth.
Right.
They want teeth that are going to be aesthetically pleasing. They want to look good. They want to feel youthful and younger and healthy. So the implants are really just a modality to give them the teeth, the smile, and more importantly, the confidence back that they're missing. So we want to be able to give them that smile back, give them back that confidence. But to do so, it's not just getting the implant in. Anybody can do the implant.
Right.
It's about doing it properly. It's about planning it. It's about making sure we do all the other things like grafting to make sure that we get a perfect outcome. And if there's going to be any kind of compromise, we want to know that up front so we can have a very candid conversation with the patient and say, hey, look, this is the damage that was done because you had some kind of diseased tooth or an accident. We want to know up front and be able to say to them, look, this can be fixed and this is how. Or, we can't fix, this isn't fixable, but this is the compromise we can expect, and here's how we're going to try to mask it. So we want to see that big smile because, like you said, that changes. And it's one thing to
Right.
inform somebody at the beginning. It's quite
Women
another
more than
process.
men?
Women
Because
more
women
than
really
men.
care
Yeah.
how they look.
Women really care.
Right.
But I got to tell you, men, although they may not care, often it's the women in their
Right.
lives or the significant other in their lives that cares more. So we have to be careful, and a lot of times we even bring their significant other in with us to say, make sure they're part of that
How long is
conversation.
this good for?
How long is the
In
implant?
other words, once you put in the teeth in a day,
Sure.
then what?
Well, the temporaries generally stay there for about 3 months.
Okay.
And the reason is we want to let everything mature, let the patient get comfortable. They're going to have a bit of a new bite. And so in those instances, we let them heal for about 3 months. After they go back and they see a restorative dentist, and that's who makes the permanent teeth. And at that point, the restorations can break down over time like anything else. They're generally made of porcelain, so think about your plates at home. They can chip or they can discolor. Or
Why
they
do
can get a
you
little
stay
crack.
away from that?
Well, you know what? We're specialists in what we do.
I got you.
And as the reference I gave you earlier about the family practitioner delivering a baby, you know what? I'm not the expert in doing restorative dentistry. There are people that are experts in that, and just as we're experts as surgeons, we leave the restorative dentistry to the experts as well. So we don't want to be hypocrites or overstep our bounds. There are people that are really gifted and qualified to do that, just as we believe we're gifted and qualified to do what we do. And so if it was my wife, they would see a board-certified specialist to do the implants and the bone grafting if necessary, and make temporaries. That would be one of us in our practice as periodontists. And it would be a restorative dentist, a restorative colleague, who has particular talents, skills, and training, and works with a top laboratory to make sure that they can get the right outcome.
So they would not go without teeth ever?
Never.
Between
Never.
this and then going to eventually restorative?
You're 100% correct. Those patients would leave with teeth, like I said, teeth today.
Instead of waiting 4 months?
No 4 months. They're going to leave with teeth. We're going to make sure they have teeth all the way through the process. When they smile, they can smile with confidence. They're going to be able to eat. They can go to weddings, bar mitzvahs,
But they
christenings.
have to go do the restorative, though.
But it's funny you say that, because my last patient, maybe the reason I was a few minutes late getting here today, was he's in a temporary with 2 teeth, his front 2 teeth, his upper
Oh, those
central
are-
incisors. He'd had an accident when he was a kid, and here he is about 60, 65, and those 2 teeth failed. The old root canals failed, and we had to take him out and put in some implants for him. And he's kind of merry and happy with his temporaries. And I said to him, look, Joe, you've been there. Those temporaries have been in there now for about 5 months.
Wow.
We only want you in there want him in there for 2 to 3 months in your case. And if he leaves them in for too long, I explained to him that, the temporary is going to start to break down, discolor, chip. But you know what? It's also going to have a negative effect on the implants, because it's going to start to collect bacteria.
Gotcha.
And he's going to wind up with some infection around the gum, and it could even affect the implants. So I kind of lit a fire under his you-know-what and asked him, hey, you've got to get the permanence on there, not
Do you
just to look at.
recommend dentists? Because maybe
We do. We
Because
work
people
with-
might not know who
absolutely,
to go to.
and we work with many very good, well-qualified dentists, both here in Boca Raton, but throughout Palm Beach County and into Broward County, and even down into Miami-Dade. We refer patients in the Northeast when we need to, in the Midwest, out West. Even over in Europe, we've referred patients when for problem solving, or if they need somebody there. We've got a couple of patients that spend half the year here and half the year perhaps over in Europe, and so we'll happily refer them to somebody that we know is qualified. We have a very wide network of very qualified doctors that we work with locally, nationally, and even around the world.
So is it still about 4 months? If they didn't go to, if they just went for straight implants, is it still about 4 or 5 months?
It depends who you go to see.
Takes a while.
It can, because a lot of people are still practicing based on religion versus science. A lot of people aren't using top quality implants. It's really important that patients ask when they go. It's not just about the fee. Good isn't cheap, and cheap isn't good.
I totally agree with you.
And there are so many second-rate implant systems out there. They're being peddled by manufacturers because they're less expensive. But there's a definite difference in the quality. These are you've got to understand. These are body replacement parts.
Right.
So this is like replacing any other part of your body. This isn't just a tattoo or something. This is
This
body
is not.
replacement part.
I'm going to tell you something. This is nothing that you go around town Googling and see who's got the best price. I even know this myself. If you do that, you might be very unsatisfied
Right.
down the road.
What the worry is that components don't fit well, restorations, meaning the teeth break,
Right.
or even worse. That's the good news. The bad news is implants can get sick, meaning they can get periodontal disease. And it's sometimes not in the patients that have a history of periodontal disease. Sometimes it's because a dentist left cement under the gum, or sometimes it's because the components didn't fit well and things start to move, and that causes irritation, and that can cause some inflammation and bone loss. So we see periimplantitis, meaning infections around the implant leading to bone loss, oftentimes because things are not fitting properly, patients aren't able to maintain them properly. And so it's really important that you see good quality surgeon, good quality restorative dentist, and make sure that you get the right quality restorations done for you.
Give everybody your phone number.
All right, we're really easy to reach. We're here in Boca Raton, 561-912-9993.
And you got some really good information on your website.
We do. Please visit us at flsmile.com. It's a robust site. You'll find a lot of great information about implants, periodontal disease, treatment for both, minimally invasive periodontal surgery, and you'll find out we've been doing this for a very, very long time.
Well, Dr. Norton will be back with us next month, and we'll be back with you next week with more Ask the Experts. Great job, Doc.
Thanks so much for having me.
We'll see you next month.
You got it.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinion